Hello and welcome to Mommy Dentist in Business Podcast. I'm your host, Dr. Grace Yum. Welcome back, listeners, and welcome to our new listeners. And if you are new here, just wanted to let you know that this podcast has been running for a good 7 years. We have won fan favorite for 4 years in a row. And last year, in 2024, we were ranked the number one dental podcast amongst all the podcasts. We are downloaded in over 44 countries, and we are so grateful for the loyalty and this community. And it means so much to us that you are here every Friday listening because we drop an episode every Friday, and the only time we miss is during the holiday season. So we're getting there. This is getting close. And by the time you listen to this one, it'll probably be 2026. Today, I'm very excited to introduce to you Dr. Kami Haas, founder and CEO of SuperMouth. Welcome to the show.
Well, thank you very much. That was very impressive, by the way, about your history as well.
Oh, thank you. Yeah, we're very proud of that. And the podcast started way back in 2017, 18. And back then, I was running two pediatric ortho offices and working, teaching residents and all of that. But our podcast was birthed and created in the midst of all of that. And the community really wanted more information that they were not getting
Hmm.
at their trade shows or their local study clubs. And we also wanted to highlight people like yourself, doctors that are entrepreneurial in spirit, that have so much information and wisdom to share. So I wanted to start with this first question. Please tell the audience a little bit about yourself, what you do, and how you got to where you are today.
Of course. So I'm an orthodontist by training, but actually my wife is a pediatric dentist. So
Oh,
we also
wonderful.
yeah. So we have a fairly large multi-location, multi-specialty dental practice now. After all these years, we have orthodontics, pediatrics, general dentistry, hygiene, endo, oral surgery, etc. And so that's one. And then I'm an author. I wrote a book that became a number one national bestseller, If Your Mouth Could Talk, which talks about oral systemic health, literally from pregnancy to, childhood to airway, sleep, systemic health and longevity. And then I also founded a dental assisting college a few years ago, which eventually became a nationally accredited dental assisting college. And more recently, I lead this new company about oral care product company that we also educate the public and the profession about oral care products and provide customized solutions for every age and stage.
Amazing. I'm so excited that you're able to educate the public and the consumers and patients, but also be able to educate doctors as well, because you are one, but you are also practicing the whole gamut, meaning you've done everything that dentists do. Now, my next question is, what major gap did you see in dentistry that led you to create Supermouth? And
Yeah.
how does this gap impact patient outcomes today?
Yeah, by the way, just to follow about your discussion about our education process, yeah, we teach at almost all the major dental conferences, about maybe 20 of them every year, because we notice dental schools don't do that, as you know, hygiene
Yeah.
schools don't do that, the
Right.
industry doesn't do it. So we felt like we can't change oral health, and without educating the profession first, what do they need to learn about toothpaste and mouthwash and floss and customization of oral care products. So anyway, so that's about the education piece. But what really was the biggest turning point in my own life, like a lot of parents, was for when my son was born. So my son is 13 year old. We were just talking about that. Before he was born, when patients would ask us, "Hey, Dr. House, what toothpaste do you recommend?" I would say whatever, Colgate or Crest, whatever had fluoride in it, because that's what I was just the only thing I knew about dental school. They said use a toothpaste with fluoride. So when my son was born, I remember after, recommending very casually to everybody a fluoride toothpaste. When my son was born, I actually went and his first baby teeth started coming in. I went to my wife, who's a pediatric dentist, and I said, "Nosli, what toothpaste should we recommend for Aiden?" And she said, "I don't know." And remember, I am one of those guys. I was a little bit of an older dad, so during my wife's pregnancy, I read every book on sleep and how to make your kids smart and whatever, everything except the one that I thought I was an expert in, which is oral health. I knew nothing about, just like all the other dentists and hygienists. And so that was the beginning of this deep rabbit hole that I went for the next several years, I ended up reading about 600 books and articles about oral health, oral systemic health, oral care ingredients, and which led to me writing my book, If Your Mouth Could Talk. And then when I would do interviews across the country with the media, with the public, with the dental professionals, with medical professionals, once I would raise the importance of oral health in various areas, the first question out of them was, what toothpaste do you recommend? And then I figured, okay, now I can educate the public, but if I don't provide them the solution, because as you probably know, with all the major, we have over 1,500 brands of toothpaste, by the way. So with all these conventional oral care products and so-called natural ones, the number one disease in the world, as you know, is dental disease. It's not cancer, it's not cardiovascular disease, it's cavities and gum disease, which tells me, and I think it's obvious, that whatever we're doing is not working. And so that's what led me to found SuperMouth.
If you're enjoying these podcasts and you want to do a deeper dive, please, whether it's about clinical information, business management, lifestyle, come check out the official membership. Our community is there and it's meant for this type of growth. If you want to expand, really, come check out our website at mommydibs.com, mommydibs.com, so that you have access to a whole community that can get you from point A to point B. Now back to our podcast. Oh, that's a great story. I always feel that dentists or even entrepreneurs create products out of necessity, and it always ties to their own story and where it is something that is true to their heart. And it sounds like you've done extensive work to figure out how to handle this kind of topic. And I think that you've created something again out of necessity, going back to your own children, your wife and your patients. I'm excited to hear more. And my curiosity is piqued, and I would love to know what you think about traditional fluoride versus the natural debate, and what scientific factors should dentists really be paying attention to?
Sure. I think our two biggest problem that what we've actually created is our obsession over fluoride or non-fluoride, doesn't matter, right? Really, the whole discussion, I remember when I was in dental school over 30 years ago now, I don't want to age myself, but that's how long it's been. The only discussion I heard over this topic of oral care was fluoride versus non-fluoride. 30 years later, that's all we hear, still fluoride versus non-fluoride. I remember a few months ago, I got an email from FDA, something against fluoride, like it was against their recommendation against water fluoridation. And within a couple of hours, I got another email from ADA asking me to be an ambassador for fluoride. This is just nuts. It's like if in medicine we only discuss, I don't know, like broccoli for 30 years while ignoring every other solution for health. As you know, and by the way, more recently we've just switched non-fluoride with hydroxyapatite. So now it's fluoride versus hydroxyapatite. And by the way, we have all of these ingredients in many of our products. But my mission really as an advocate of oral health is to change that obsession and move it from a single ingredient discussion to really bring up back into consciousness that, hey, our oral health is more than just enamel. Your teeth are very much alive on the inside, first of all, and then we have the saliva, we have the whole oral microbiome, the pH, the soft tissues, the growth and development, the bones, the airway. And so our really mission at SuperMouth is not just to provide products, which we do, we customize products based on age and risk factors, but also provide the education, the tools, the fun, the entertainment, everything to really create the next generation of really health and not just fight over fluoride for the next decade.
I agree 100%. And I also think that being an ambassador to bring to the table to discuss what are the options, because patients are asking, right? Like you said, fluoride isn't the only answer, right? You're talking about hydroxyapatite, nanohydroxyapatite, xylitol was brought into the mix a while ago. We're talking about different options. And even culturally, there are different, many internationally, right? If you look at the global picture, there are many cultures in many different countries that use different products, right? Like oil pulling. And that's just one example. It's not the answer and cure all for everything, but one has to consider what are the options? And it's not a one size fits all solution. Like you said, when you look at the microbiome, right? If dentists took the time to scrape teeth and look under a microscope and actually see what bacteria is sitting in that mouth and custom tailor to what that patient needs. What are we addressing? Why are the cavities happening? Why is the gum disease happening? And figuring out and pinpointing rather than just throwing a band-aid like, oh, you need more fluoride. Oh, you need this. And I think it's a very comprehensive approach, right? We're looking at the oral systemic as a whole, and you have to look at the orbit of what needs to be connected to what. And I think that what you're doing really helps to address customization tailored to each patient. And I just love that you're bringing that awareness to dentists, to dental students, to hygienists, and it's just an important topic. Now, going back to oral care needs and what people need, right? You were addressing pregnancy, childhood, patients in orthodontia, adulthood, even looking at seniors, right? What do most clinicians overlook about age in the stage specific care?
That's a great question. So let me just ask you and the audience this question. Let's just say tomorrow or Monday, whatever the first day is you go to your office and you have a family sitting in the chair next to you. There's a pregnant mother, a dad with gum disease, an infant or a baby 1 year old with no cavities, a 10-year-old that gets a cavity every time you see them, and a teen in braces. And they ask you, doctor or hygienist, what toothpaste do you recommend? Right now, if you're in the camp fluoride, you're going to recommend something with fluoride. If you're camp anti-fluoride, you do something with non-fluoride. But this doesn't make any sense. If I ask even non-dentists, do you think these five people I just explained, should they get the same toothpaste and toothbrush and mouthwash and floss? They're probably going to say, of course not. These are five completely different people with different needs, but yet we do it, we just, because, and by the way, I don't blame us as the profession because we're not educated. It's really shame on our dental school and education system that we don't learn this in the dental school. On the board of UCLA, and we're like constantly talking to the dean about we need to teach our students and the next generation of dentists what's in these products, not just fluoride, but what
Right.
are all these other ingredients?
What are the chemistry
Exactly.
inside? What is putting in your mouth?
That's right. So I'll give you a quick example about those five. Like when you're pregnant, you have all these hormonal changes. According to CDC, 74% of pregnant women get gingivitis. And so do they require something exactly the same as an infant? In an infant, the oral microbiome is evolving and maturing in the first 2 or 3 years. So we don't want to use antimicrobial agents. By the way, it doesn't have to be chemicals. Like when I say antimicrobial, people sometimes think I'm talking about amoxicillin, but essential oils are antimicrobial agents. Stannous fluoride is an antimicrobial agent. So all these things, we need to be careful about not decimating the oral microbiome. Or, as of course, I know you've had an orthodontic practice. So in orthodontics, as you know, 2/3 of people in braces, 1/3 of people in aligners, they still get decalcifications because they have very unique needs, and on and on and on. So what we do at SuperMouth, we customize these oral care products based on age, risk factor, stage, and personal preferences. And then that's what we have, about over 200 products and nearly 300 patents. This is just to tell you how much innovation we have had. The reason we have so many patents is because literally every product we touched, we had to invent it. Why? Because if it worked, the number one disease in the world, which is almost entirely preventable, wouldn't still be dental disease.
Correct. Well, maybe it's just job security.
You mean for dentists?
Yeah.
Can I
I'm
actually?
half joking. I'm
No,
half
you don't. I know you're half joking, but I'm so happy you brought this up because I think it could be on the mind of some. So maybe I can address this if you don't mind.
Of course.
I think I've talked to people, and jokingly or not, they always tell me, "Why do we even want to prevent cavities? Like we'd be out of business." let me tell you this. One is people are already using a toothpaste and mouthwash and toothbrush. Secondly, they're learning a lot more outside of the dental. They have access to information and education.
Right.
Prevention is coming. Oral health and the education about it is growing. I'm getting invited to all sorts of organizations from longevity to CDC, by the way, is going to put a huge campaign around educating the public about oral health. So if we,
Well,
go ahead.
I have to mention it's CDCP. It should be Centers of Disease Control and Prevention,
Prevention.
but
Exactly. Thank
people
you.
drop that P.
That's exactly, and prevention. And so, so if we recommend truly correct oral health prevention to our patients, if they see us as true oral health advocates and not someone who's just trying to do a filling and do some cleaning or do some braces, then they trust us more. Then they refer to us more.
Yeah.
Then they're going to be more loyal patients. They're going to stay with our practice more. They're going to accept our treatment plans more. They're going to take care of their oral health. Now
Of
they want to
course.
do a comprehensive treatment. So I
Yes.
got to tell you, this short-sightedness, not just about this item, but if you're a short-sighted person and you only think about one small issue, you miss on this much bigger avalanche that's coming. So those of us who see the avalanche that's coming, we either get on it and benefit from it, or we're gonna get buried by it.
Well, honestly, though, it's all about building relationships and trust, right? And if you're doing what you should be doing, which is to do no harm and act on behalf of the patient, right, their best interest, then that all should align, right? And by
100%.
the way, I want to add there's a sixth person in that waiting room. You said there's five, and I'm going to add one more, Dr. Haas. The sixth is the grandparents. How many
That's right.
times does grandma and grandpa come with the whole family, right?
A hundred
And
percent.
as pediatric dentists, we're like, oh my God, not everybody can come in the room. Just one adult
I
please.
know. In fact, actually, a lot of our PDS, because we have a full lineup, we actually divide kids into three groups, teething, primary dentition, mixed dentition. We include the teens as part of the adults because like their oral health is almost the same. But as you probably know, a lot of grandparents are the ones who buy actually the oral care products for their grandkids, right? They're
Mhm.
really part of and as seniors, their oral health needs change. They have more
Right.
gum recession, they have more dental sensitivity,
Dry mouth
dry
and
mouth,
yeah.
medications, complications. So 100%. So thank you for adding that other category. And by the way, just going back, I know this is a business group, I assume also in addition to obviously being all dental experts.
Yes, yes.
And so okay, let me kind of tell you how crazy our model of oral care products is today. The conventional oral care product companies, I won't name them, but you know which ones, somehow they brainwashed us to think this is normal, that we pay them to buy their samples,
Mm.
then we pass them out for free to our patients so that our patient can go buy their products on Amazon or retail stores. So literally we paying them to be their salespeople. I think it's just nuts. And the fact that we continue to do this, it just tells how much they brainwashed us to think this is actually normal. So in our model of SuperMouth, we're not only providing the best care for your patients, but we have, because this company was founded by dentists and medical experts and physicians and hygienists, we actually provide a business model that you can recommend oral care products to your patients. We actually ship it to your patients if you want. You can have products in your office if you want. And so it's a kind of a seamless, and we provide the education. We even bribe you to be educated. Like we not only have our own CE courses, I know with your organization, we're going to have some webinars, but not only they get these CE courses, but by watching them, they get credit to buy free products from us for your practice and for
That's
family.
wonderful. It incentivizes them, it reduces friction, and it's just easy, convenience. Because as you know, in a family household, who does all the shopping? The women,
The mom.
whether it's grandma or mom or
80% of the
auntie.
healthcare decisions. Exactly.
Right, right. And so if a busy woman who is working and parenting, you have to remove friction,
That's
right?
right.
And the other thing is, like you said, going back to dental schools, they're putting these products in the dental students' hands as well. And so when they graduate, they don't know any better, right?
That's exactly right.
They don't know, like you said, it's extreme form of marketing on their part because that they consider that investment, right? And so a lot of times dental students will leave And how many times do you have an associate that says, well, in dental school, we learned this, or in dental school, I only use this
That's
composite.
exactly right.
And they only want to stick to that, and they're afraid to try
Hmm.
new things unless you mentor them. And so I think that it's really important to start this dialogue, change the script, invite the students and dentists to the conversation of oral systemic health and what we really need to do to provide the best for our patients. And it goes down to having more options. And what you're providing is another option with better design, better intention, and better care. And my next question for you then is how can the better designed oral care products improve patient compliance, especially teenagers,
Hmm.
reduce emergencies, elevate preventative care in a typical dental practice, whether it's specialty or non-specialty?
Yeah. By the way, before I answer that question, I want to just touch upon the schools that you mentioned. You're 100% right. When I ask a lot of dentists, why do you recommend brand X or brand Y? And they say, because I was given this product when I was in dental school, so I'm
Right.
still doing it. And we're either scared to try something new because they feel like, well, if the dental school supplied it, it must be good. And by the way, we're changing that. Like at UCLA this year, they completely switched to SuperMouth. That and moving forward, other hygiene schools and dental schools are switching, not only in US, in Canada as well. So we're very excited about partnering up with all these institutions because, as I said, we just don't want to sell just products. We want to educate the next generation, current generation, and the next generation of dental and oral health experts. But answering your other questions about how could this help dental practices. So just think about it. That model that I just mentioned that we pay right now to be the salespeople of oral care product companies. Now think of it as the other way. Like my own family, everybody's in hair business. And I can tell you most, like my wife, used to buy all of her hair products from her hairstylist,
Of
and
course.
yet she would buy her toothpaste from whatever, a grocery store or online. That's
Mm.
just nuts to me. I feel like we should know more about
Right.
oral health and customizing products because we're examining these patients. We know who needs what. We should be in charge of their oral care, not just the 2 days that they come to see us, but for 365 days. So our business model allows that you can not only get all the products you want, like the most offices work in a hybrid, they have some products in the office, but because we have over 200 products, they recommend SuperMouth. The patients get a discount to buy from them instead of, like, that's another thing. If I wanted, like, I give, like a brand of toothbrush would come to me and would say, sell this. As I was recommending it to my patient, they were ordering it online for much, much less money that I could sell it to. But our model is completely different. The patients actually get the best deal from the dentist or the hygienist. So they're encouraged to buy it from them. And then once they buy it from them, we lock their family to that account for life. And whatever they buy for forever,
Yes.
they get credit for it. So this is an incredible way to make passive income, uh, grow your business, grow the trust, have long-term more loyalty from your patients. And by the way, again, because this is a business environment, every dollar, most of these patients eventually go to subscription because
Yeah.
you go through your toothpaste every month or every couple of months, mouthwash, toothbrushes, etc. And every dollar you earn from a subscription business is worth $8 when you earn it from a services or product business like dentistry. In other words, if you make $10,000 from your SuperMouth business, it's equal to $80,000 profit that you're making from your dental practice.
Which is incredible. And I think it's a really great opportunity for dentists because why not? And it's right there in your office. You just put it on the front. For me, I had two and I sold my practices and we were fee for service. And I had products at the front, just like when you're checking out the grocery store, you have products in the front, right?
Exactly.
But the thing is, when you make it look nice, the kids want to choose, right? They want the
Exactly.
colors and they want this and that. But again, for me, it was pricing. Now, for listeners, Dr. House just mentioned they're online Amazoning it, right? Because they want the best price. So you have to match that price, right?
We
Because
not only
otherwise it could,
don't exactly we don't match, we actually make sure that the
right.
dental
So
professionals always have the best deal
best deal.
and the most of the collection, most variety. And by the way, in addition to just putting it on the front, again, because I'm a business person and a dentist, one of the few that love both sides of my profession, and we do more than just allowing the dentist to just display it in their office. We actually proactively manage their sales for them. I'll give you an example. We've developed an artificial intelligence consultant that, you know how when you go to your dentist, you have to have medical history forms. So you
Hmm.
integrate that in your system. You don't need, there's not even any coding. You can just add a phone number. Our AI consultant on the behalf of the dentist or the hygienist will call the patient, go over their usage of their oral care, their their needs, their risks, their desires, what's are the pain points, and then recommends oral care products
I
for
love
them.
that.
Yeah,
I
so
love that.
many tools like that to educate, to entertain. We have created a whole world of superheroes and villains for kids, these high-tech devices for adults, and on and on and on.
Well, it's incredible. And I think that dentists who are interested should definitely look into this. And again, as dentist, I always look to set myself apart from other dentists in the area, right? And
Exactly.
it's all you're always looking for things to add, whether it's AI, whether it's product, whatever it is to set yourself apart. You can't do the same old. You can't
You
keep
can't.
doing the same thing over and over again because growth happens, right? And
Right.
as an entrepreneur, more growth in patients. I hear a lot of, I need new marketing. I need new marketing. And I'm like, I'm not getting new patients. I'm not getting new patients. And it's like, well, before you go and pay a marketing agency, right? Why
Right.
don't you look inside and see what you can do organically like this, right? Service, right? And I think that patient service, not just the filling that you did, not
Mm-hmm.
just the braces that you put on, but what other services are you putting out there for your patients to be wowed? And I think this is a great addition to adding on to your patient service care. Now, my next question for you to keep this podcast going is you were talking about obviously creating opportunities, financial opportunities, incentives for dentists to integrate a subscription-based model, you know, brushing system, right? That goes out every 3 to 6 months. And it's based on science and your oral care systems. Like you were talking about practice revenue and patient loyalty and how to get that done. Now, going a little deeper into this, I'm assuming you have some kind of dashboard. Do the dentists jump online on your dashboard and track everything? How are they able to see the ROI? How are they able to see what kind of commission or sales they're getting? And again, listeners, you might be thinking, oh, I said the word commission or I said the word sales. And I think if you are a practice owner, you need to get used to that. Money isn't dirty. Money is currency, and money is what makes your practice thrive and puts food on your table. So get used to those terms and get used to this idea because at the end of the day, if you own a practice, you need to know the money, right? So let's get down to the dirty, nitty gritty and talk about it. Let's
Perfect.
talk about it.
Well, perfect. And by the way, we call that a retail profit, as far as like, how they get paid. But nonetheless, by the way, I feel like you just talk preaching to the choir. Like the words you just said are the words I always have to tell all my friends. I was having a coffee with a friend of mine from dental school, and she asked me if I could help her with the collections. And I said, sure. What's your process? She said, no, call my office manager and ask her. And I'm like, yeah, I know she does it, but can you tell me what the process is so I can help you? She's like, I don't know, my office manager. I'm like, you don't even know? Like, this is a 30-year dentist, right? That doesn't even know what the process is. I'm like, how do you know she's doing it correctly? How do you know she's not embezzling from you? I mean, you can't, listen, I'm all for delegation. I have over 400 employees in my dental practice just alone. But I only delegate things that I know it thoroughly because then I know I have checks and balances. I have reporting structures put in place. I know exactly what they're doing. I know how to train them. I know who's doing well, who's not doing well. So believe me, I'm all for delegation. But it's up to all of us. We cannot be a great dentist unless we're also not great business people. And so I love to be, on this interview with you and doing things like this because I want to really just remove this barrier of, like you said,
Yes,
people thinking that money is bad. No, you
right.
can't. I honestly don't know a really great dentist that is also not a great business person because how can you not? If you want to buy the best equipment, if you want to hire the best, you want to train them, you want to have the nicest facilities for your patients, and on and on and on, you have to be successful. And so yeah, being successful is part of the job, and we all have to learn how to run the business of dentistry if we want to be great clinicians as well. So these are the two tracks. But to your question, because this again, because I knew that dentists are very resistant and hesitant when it comes to business, we kind of wanted to make it really, really easy. So our business model is, as I said, we put dentists and hygienists and physicians because we also have like because we have pregnancy products and
Mhm.
a lot of cancer organizations love using our products because we have clean ingredients, et cetera, for their patients. But so anyway, we put them on the pedestal, and so everything from the way they can recommend our products to their patients are several ways, as easy as just providing a discount code, or we also make it a personalized custom SuperMouth website that they can link to their own website. So as just like they provide services on their website, they say we have orthodontics, we have pediatric dentistry, and we also provide oral care products, and
Mhm. Mhm.
patients can seamlessly buy it from there. They can
Mhm.
also have products in their offices as a wholesale, and they can sell them, or they do a combination of those, and which almost everybody does. To your point, as far as how they check this, yes, we provide a complimentary dashboard for them, which has an office, back office that they can not only, because you know, and I know, like the way we successful practices, the way we do things in our practice is we don't tell a patient, do you want to fill your cavity? Call us whenever you want to, right? We recommend it, we have the authority, we come across like we're knowledgeable, and then we book it or we do it right then, right? And this is how we recommend our affiliates and our doctors and hygienists do it. So we have really easy ways on their phones or on their computers. They recommend the product. They either sell it right there, or they text it or they email it to the patient,
Mhm.
the full collection of the products that's recommended, and then the patients buy it. As I said, the nice thing about our business model is once the patient buys one product from them and uses their code or their website, their replicated website, then we automatically lock not just that patient, but their whole family to their account for life. And now they don't need to ever worry about it. Whatever that patient buys online, they get retail profit of that. And then they have obviously a dashboard that they can manage this. We give them
Mhm.
reports. We gamify it. We try to educate them. We have a ton of education resources online, webinars, CE courses, in-person lunch and learns. As I said, we teach at almost every major dental conference so they can see us. Interviews like the ones we're doing right now, and on and on and on to really make sure that they are as successful as they are in their dental practice in this endeavor, and also they're learning. So because like we were discussing, patients are already learning about this stuff. They already know, have gone way beyond
Right.
fluoride. So it's
Right.
up to us that we get educated so we don't look embarrassed when a patient's asking us about nanohydroxyapatite or about
Right.
prebiotics or about this brand or that brand. And the other thing with our company is because we have 200 products, you don't need to have one brand for toothpaste, another brand for toothbrush, another one for orthodontics, one for pregnancy. We have every single product you want and with zero compromises. No compromises in safety, nothing in efficacy, and nothing in customization.
Which I love because it's all right there and it's all in the patient has the ability. And it's similar to as if the dentist is a distributor on the patients can go on the website and also choose. There's a whole library of things to choose from. And then whoever's doing the purchasing can say, oh, you know what? I want this product for my, husband. I want this product for my mother. I want this product for my sister. And it's all in one house. And I think that that makes the most sense because it's a one-stop shop. Now, again, dentist, if you're listening and you're still not following, an analogy I would say is like a medical doctor saying, "Oh, well, I recommend this set of vitamins. Like you just did your
Exactly.
blood work. You know what? The doctor might partner with a company called Metagenics or something like that, and they might say you're going to need B5, you need omega-3, you need vitamin D, and then boom, you set it all up and it gets sent to you. So it's similar to that process, and it's something that patients are very familiar with. So it's not
And they
like,
wanted.
yeah,
Grace,
yeah, yeah.
to echo what you just said, there was just a large study that just came out that they studied, a lot of people, and they asked him, how do you want your dentist to recommend oral care products? Do you want your hygienist to recommend products? Not only they said yes, but they said they trust the dentist and the hygienist recommendations over anything else, over any
Of course,
social media, over any
of
influencer, over
course,
any ad. Of course,
of course.
because our patients trust us. If otherwise they wouldn't, if they trust us to do a filling or extract their son's teeth, Of course,
course.
they want us to recommend oral care products, but we can't recommend it if we're not educated,
Right.
and if we're just stuck with something we learned in dental school about fluoride, or we hate the fluoride because somebody told us,
Right.
and we just are obsessed over one ingredient or one thing.
Right.
We need to be broad, just like we learn. And by the way, the good thing about this is it doesn't take too long to learn about oral care products, even though it took me many years. But we have an ebook. It's called the Oral Care Revolution. I think in 30 minutes, you'll learn 95% of everything that every dentist and hygienist need to know about oral care products and oral care ingredients and the science behind oral care and oral health. And so we have all these tools that we've spent years develop so people can spend minutes or hours learn about it.
Well, I think that it's a really great service that you're providing and that you're helping our whole ecosystem from, dental students to the dental team to the doctors to the patients. And I think that everyone being on the same page should be good because you know how many times I'm at Target and I go down that oral care aisle
Yeah.
and I'm not there to buy anything. I just want to see what's on the
Sure.
shelf.
Yeah.
And, there's consumers and there's other moms looking at this and that. And I'm like, I can't control myself and I'll just say, oh, put that down. Don't pick
That's
that
right.
one.
We're all confused. I mean,
Yeah.
seriously, I mean, nobody knows what's the right product anymore because there's just so much controversy
Well,
and
so
so much
much.
obsession over this one ingredient called fluoride.
But not only that, consumers, again, look for price.
That's
If they're not educated, right, and they're buying their product from the drugstore, they're going to go with either brand recognition, what they see on social media, or I used to say TV commercials, but nobody's watching TV or
right.
commercials, or they're going to go with the cheapest price,
Or,
right?
third one, the one that says natural on it. How we
Yes.
joke around that cocaine is natural, arsenic is natural, alcohol is natural, sugar is natural. As I can go on and on and on. Just something that's natural. This is where we are.
Obsession. It's an
We're obsessed. And by
obsession.
the way, I can understand the obsession. We are at the bottom or the near the bottom of almost every healthcare indicator, any health indicator as a country. We're very advanced in many things, but our health, as you know, it's not one of them. And so we're desperate for something that's clean and safe.
Hmm.
And so people
Hmm.
go for something that says natural and they have no idea what's in it. And so our company, again, yes, we don't use anything artificial ingredient, no artificial preservatives, colors, flavors, sweeteners.
Yeah, no
We only
lauryl
use natural
sulfate,
ingredients.
sodium lauryl
That's
sulfate.
right, SLS. But by the way, just we use a third-party safety verification. It's called EWG, Environmental Working Group. So for those of you who are wondering what's actually safe, you can go to ewg.org. It's an international organization on safety of from everything from shampoo and toothpaste, and they rank ingredients from
Mhm.
1 to 10. 1 the safest, 10 the most toxic. Fluoride that everybody argues about is 2. SLS is 2. You know what's 10? Like PTFE, which is forever chemical that a lot of the most popular flosses on the market have, it is a 10 out of 10. It's literally the most toxic ingredient, and we've ignored it because we've been obsessing over fluoride. And by the way, the most permeable part of your mouth is the sulcus. So if you're using a
Mhm.
floss with forever chemicals, it's actually literally the most dangerous thing that you could be using. These essential oils like peppermint oil is a 5 out of 10, so it's 2.5 times more toxic than fluoride. And by the way, if you love mint like I do, like because we've all been brainwashed, spearmint is a 1 on EWG. It's actually much safer. It tastes better. It's not bitter, and it doesn't overwhelm that sense of
Mhm.
your mouth. Actually, you can go have breakfast after you brush your teeth, which by the way you're supposed to. You're not supposed to brush your teeth after breakfast, and on and on and on. So we don't, again, that's why I said there's no compromises at our company. We don't compromise on safety. We don't compromise on concentration of ingredients. We always have the right concentration, the non-GMO version of the ingredients. We're obsessed with every little detail on from packaging. Our packages turn into toys and gifts or game boards because we don't want the customers to throw them away readily because we also
Mhm.
environmentally responsible and on and on and on. We've really tried to do this right this time.
I love it. Well, thank you so much for spending this time with us and for our listeners to get educated and more acquainted with you and what you are passionate about. Before we end the podcast, I always ask this last question. And since you are a dad, you are considered a daddy dentist in business. What is your number one piece of advice on how you're doing everything?
All right, so I'll tell you, it's something I always discuss with my son too, because I spend most of my time even though I have all these businesses and I love it, I spend most of my time driving my son to school and back and all this stuff because that's really the most joy and it's just something that I can't take back as the time goes by and he's 13 and right now is the most precious time and all the things that he's learning. I'm trying to plant as many seeds as I can,
Yes,
over the next few years,
yes,
right? Before it
yes,
goes up. So for me, like I always talk to to people and I listen to you know people and I read books and everything and like the word balance that people ask me sometimes I think mistakenly people think it means equal hours. Like you
mm,
work 8 hours, you have fun 8 hours, and then you sleep 8 hours. I think this is completely absurd. If what I think balance should be, and that I feel like that's why I feel like I can do all this stuff is because first of all I'm passionate, as you can probably tell. That
yes,
otherwise why even doing it?
right.
I want to look back, the last year of my life, and I want to look back and I
Yes,
said I did everything I wanted, everything. That includes
yes,
spending time with my family and traveling and building every company I wanted and tackle the number one disease in the world, which is dental disease. How
yes.
exciting is that? I mean, if you had the cure for cancer, would you just sit home and,
Right.
sleep in? No, you would do something about it. And I feel like we may not have the cure to cancer, but we have a way of reducing cancer risk by 14%, Alzheimer's by 70%, all these
Yes.
things, because they're all related to oral health, by the way. This is how it
Yes, it all starts here.
all starts here. And so going back to delegation, the way I've been able to manage my life and doing all this stuff is learn everything myself really, really good, then hire the best people in the world that I can, and
Yes.
then delegate a lot of these from my business things, from people who run my various businesses to having my personal life. I have a personal assistant, which I've had for 15, 20 years, because everything I don't want to do, like stand in line, wait for the, whatever the air conditioning people to show up and grocery shopping, washing dishes, whatever it is that I personally think is a waste of my time. So I can spend time with my wife and my son and travel and just learn and read books and talk to you and, run businesses. Then that's really the key. So my one advice is learn everything you can and delegate the things that you don't want to, but put systems and of checks and balances together to make sure that everything's operating correctly. And then with peace of mind, you can have a balanced life, not in hours, but in contribution of
Yes.
what you love and you're passionate about.
I 100% agree. Train, trust, and verify.
Exactly.
That's well, I mean, and I tell this to our mommy dentists, all the women, because as women, sometimes we have a hard time letting go of all the things in our house, right? Like in our
100%.
house, in our home, we want certain things done a certain way. And also, I think I just want to add to this, sometimes we come from, again, culturally, we might grow up a different way.
Hmm.
And sometimes I think doctors might think they might be the first person in their house to go to college or the first person to be a professional. And their parents didn't teach them that it's okay to spend money on an executive assistant or a remote assistant. It's okay to hire a cleaning lady. You don't have to clean the house.
Exactly.
It's okay to hire a chef. It's okay to have somebody come and do the things so that you can buy back your time. So I just wanted to throw that out there because sometimes people have imposter syndrome and think, well, who am I, to do that? Like I'm not some rich billionaire person that can do, but that's besides the point, right? The
That's right.
point, the point is,
I'm
like you said,
I'm so happy you brought that up because that was me, by the way. About 15 years ago, I hired this orthodontic consultant, or maybe 20 years ago, I should say, probably, yeah, before my son was born. So 20 years ago, I hired this practice consultant to do whatever she was going to do in my practice. That last year, when she was leaving, she sat me down. She said, Kami, I want to give you a piece of advice that's going to be worth so much more than what you hired me for to do. I'm like, what is it? She said, you need a personal assistant. I'm like, what? I mean, she was there to give me consulting on my how to run my orthodontic practice. But she spent 2 or 3 days with me, and she said how she saw how I was like all over the place. I was picking up folds, talking to 10 people, then go grab my own lunch, whatever. She sat me down. She said, and just like you said, Grace, right after she left, I laughed about it. I'm like, I told my wife, who does she think I am? Like, I'm not, a billionaire that will have my own personal assistant. But she planted the seed. So 3 months later, I hired my first personal assistant,
and I had no idea what to do with her. Like I was embarrassed to ask her to go get my lunch or like whatever, because I'm like, that's embarrassing. I'm an adult, you know. I've never really asked like an adult to help me with my personal stuff. And so, you know, maybe that didn't work out for her after that. And then within like a year, I had the best personal assistant. I mean, the personal assistant who's my assistant right now. Been with me 15, 20 years, and she's part of our family. And she literally does everything and anything. She knows more about me and my personal things than anybody else in the world. But because I trust her and I delegate, just like you said, trust, verify, and she delegates everything, like my travel arrangements, my my doctor like visa. We're traveling next week, so she's working all everything, like literally my food. She has to pick up a medication for me. She has to
Yes.
wait on the phone for 3 hours. She wants to schedule a call with my attorney, whatever, everything that I feel like I hated, this is a waste of my time, she does. And other people.
Exactly, exactly,
So to your
exactly.
point,
Well, we'll just do another podcast on
I love
how
on
to
personal assistance.
get a prescription. But
Exactly.
it's wonderful to hear because, I'm so glad to hear that you say that because a lot of times the women will say to me, my husband is not in support of that, right? My husband will not support that. And so sometimes I think, I want to broadcast, hey, if there are spouses that are listening, that especially married couples, one way when both people are really busy and they're both working or the mom is overwhelmed, maybe too many like things on her plate because there's so many children and depending on their age what they're doing. And I think that spousal support is really important to create harmony and reduce stress in the home. And one way is to have a personal assistant that you can share, right? So my husband and I, we share one, like he has his own, obviously, executive assistants for his work and all that. And I have my own team and he has his own team. But we decided we're going to share like a house manager, right?
Exactly.
Because we can't do all the things, the two of us
And
either.
how has that turned out for you?
Oh, we love that,
It's amazing,
It's
right? Once you do
amazing.
it, you're like, and that's, it's
What
like,
was thinking?
I know, like when honestly, when people ask me, can you give us one advice, like for business, or how do you become successful, or like, I'm like, if I see they're like overly busy and they don't have time to learn and grow, I tell them
Yeah.
you don't have to even hire a full-time personal assistant, just get a part-time one to
Yeah.
take to all of a sudden you have all these extra hours that you never had before,
Right.
and you can now do
Right.
all the things that you've always neglected or you've,
Right.
procrastinated or
Well, just think about this way. If you're taking baby steps, look for maybe like a high school college student in your neighborhood to take some hours off, right? Maybe
right.
pay them $300, $400 a week just to buy back some time. But guess what? $300, that's like four dental sealants, you guys. Come on.
Exactly. And the amount of learning and doing, right, that you can do with those
Right.
hours, it's unbelievable. And you can't take back time, right? We're all getting older.
Right.
And
Right.
again, as I said, I'm constantly reevaluating my life. You probably heard of the 80-20 rule, right?
Oh, of
That
course, the Pareto
you
principle. Yes.
20% of your effort make 80%. And if
Yeah.
you keep going, right? If you get to that 20%, that's all you do is that 20%. And then you pick the 20% of that. Over time, you can become very efficient, but efficient doesn't
Very.
mean to be stressed. It means that
No,
you only do the things that are important to you and you
exactly.
can only do or you only want to do them. Like,
Yes.
of course, I can hire somebody to take my son to school, but I don't want to. That's like the most
Right.
precious time in my life, right?
Yes.
And so I do that. But I
Yes.
don't do anything that I don't want to. Literally,
That's
but I
right.
have to constantly reevaluate this as my life gets more busy and
Yes.
new businesses
Yeah.
arrive and we have new challenges and et cetera, new opportunities, et cetera.
Well, thank you for sharing that because it's really important for people to hear that. And for listeners, if you are inspired, if you're motivated, find the right people to help you delegate. If you're in a dental office, you have a whole team for your dental office. You need a team at home too. And
Exactly.
honestly, it can be done. And if you want a time to create, right? And Dr. Haas is a dentist, but he's not sitting there doing everything like he said. He's not going to go out and pick up his dry cleaning, right? Because his time is better spent innovating, right? So finding your unique ability and what you're passionate about to spend that time in your unique ability to create because you need time for that. And if you're running around doing grocery shopping and getting dry cleaning, that 1 hour you could have been sitting down writing your next book. So on that note, I mean, Dr. Kami, I could talk to you for hours,
Yeah, me too.
but our podcast is coming to an end. Thank you so much for your mentorship. Thank you so much for your time and sharing your passion and excitement for the love of our profession. And for listeners who want to get in touch with you or know more about you or ask you questions, what is the best way for them to reach you?
Sure. So, of course, you can go to our website, supermouth.com. That's for the science and the products. If you want to learn about how to join us and be, join the oral care revolution and be one of our pros, you can go to supermouthpro.com where you can learn about the affiliation and you can actually get some samples or apply to become a pro. You can obviously, you can email me if you want. My email address is, I'm sure you can add it later, but it's my first name, Kami, Kami dot Haas at supermouth.com.
Wonderful. Well, thank you again so much. And listeners, if you love our show, please give us 5 stars on your favorite platform, wherever you download our show. And you can always listen from our website, YouTube, Apple Podcasts, wherever, Spotify. And I just really want to say thank you. And I can't wait to bring you 2026 because it is going to be the year of the horse. And the year of the horse, if you know Chinese astrology, I mean, I'm Korean, but I still like to follow Chinese astrology. If you know anything about, okay, so it was the year of the snake, and the year of the snake is about shedding. So shed, the snake's skin sheds, right? And then the
Uh-huh.
year of the horse is about running and momentum.
I
So
love it.
everything that you're going for, put your intention down, write your goals, run after it, because it's going to be a really strong year. So many blessings, and we will see you next time. Take care.
Thank you.